This is Crohn's and Colitis Foundation Perspectives on ReachMD. The following episode is brought to you by the Crohn's and Colitis Foundation and the American Gastroenterological Association.
This is Laurie Keefer coming to you from Mount Sinai for the second annual Crohn's and Colitis Congress in Las Vegas. Here to join me about the upcoming Trends in IBD Care session is Joel Rosh from Atlantic Health System. Joel, what are you most looking forward to in terms of this session?
So, Laurie, thank you. The session, as I see it, has three very interesting parts. There are plenary talks, which really are state-of-the-art talks, and some abstracts, and then breakout sessions. And I'm really looking forward to the plenaries and the abstracts. When we think about models of care for our IBD patients, we think about models that will incorporate the whole patient, deliver a holistic approach to the entire patient, not just drug therapy, but also with all the tools that we have today, how do we incorporate big data, apps, everything that's out there in the world? And I think our plenary talks are designed to help us with that. We're going to hear from Millie Long about clinical trial data and how do you apply that to your real-life patient, and how do you think about a real-life patient who might go into a clinical trial, real-life kinds of questions. As a pediatric gastroenterologist, I'm very much looking forward to Jeff Heim's talk about looking into the future and what we've learned from PROTECT, which is a prospective cohort of pediatric ulcerative colitis patients, of how to best predict which patients are going to do well, which patients are going to do poorly, and how do we make personalized therapy a reality. And some of our abstracts are going to really open up the door to knowledge as well. You know, a lot of the gastroenterologists in the community and academia take part in chorus through the Crohn's and Colitis Foundation, and we're going to hear from one of their abstracts of how do we predict which patients are most likely to be time-intensive in the emergency room, utilizing resources. Those are the patients I know you spend a lot of your time taking care of.
Yes, that's great. And I'm actually also looking forward to the latter half of the session where we're going to have some breakout panels. That the first breakout is really focused on building an IBD center that addresses all these multidisciplinary features. But we're sort of splitting that into two components. The first will be for people who are practicing and looking to set up IBD centers, maybe more in an academic medical setting, versus those who might be looking to do the same in a community practice. And so we have some really great experts who've done it, who have some great tips for our team, and I'm really looking forward to that part. And then the second breakout is moderated by Michael Kappelman, and he'll be helping us understand how do you really manage the patient from the point of entry into care to getting them their medications, insurance authorized. We have a clinical pharmacist that'll be speaking on that panel, as well as how do you get your patient access to psychosocial care or nutritional care in the community setting. So I'm really excited about being able to broaden what we already know scientifically into real practical tips.
Yeah, it sounds very real world, very practical, right? Has that song go 525,600 minutes in a patient's life during the year, and yet they're in our office, 60 of those minutes? And so how do we take care of them the whole time? It's great. Those breakouts sound really exciting.
Yeah, I'm really looking forward to it. So, well, there's certainly a lot of takeaways here, and we're looking forward to a great session. Again, I'm Laurie Keefer. I'm coming from Mount Sinai, and this is Joel Rosh from Atlantic Health System in New Jersey, and we look forward to seeing you. Thanks for your attention.
You've been listening to Crohn's and Colitis Foundation Perspectives. To access other episodes of this series, visit reachmd.com/foundation, where you can be part of the knowledge.